everyone, I'm your host Masilo Logwabe and welcome to PPEV. Now our special guest today has a number of belts to his name and he'll be giving us some insights on diseases of the anus, rectum, colon, stomach and aesthetic veins. Please welcome Dr. Chamisa. Doctor, thank you for joining us. Now, Dr. Chamisa, you're a specialist general surgeon. Can you tell us more about what you do?
Thank you, Marcelo, for inviting me to the audience. Yes, I'm a specialist general surgeon and a laparoscopic surgeon, and I'm also the founder of a PPEV, which stands for Proctology, Pelvic Floor, Endoscopy and Aesthetic Surgical Center. And I've done further training also in the fields of proctology and pelvic floor, endoscopy and aesthetic veins. The details we will discuss as we go along.
All right, doctor, can we start with proctology? What is proctology?
Marcelo, proctology is a study of the diseases affecting the anus and the rectum, and some of these diseases are cancerous and some are not cancerous. So it's a very common condition in our population, and I would say more than 70% of people coming to my clinic do complain of proctology conditions.
Okay, doctor, can you give us a list of the common conditions in proctology which you commonly treat in your clinic?
So in proctology, we do see several conditions in the population. The most common condition is piles, also called hemorrhoids. And secondly, we see patients presenting with a pain around the anus. It's a condition called acute fissure anal. I also see patients coming in with either an abscess or a boil affecting the anus and the rectum. Besides that, we see patients with cancer affecting the anus, the rectum and the colon as well.
Of all the symptoms that you have just mentioned, which one is the most worrying as a doctor and why?
Marcelo, as a surgeon, the most worrying symptoms is that of bleeding from the anus or the rectum. This is because this may be a sign of an underlying cancer either in the colon, the rectum or the anus. So that's a very worrying symptom which needs to be investigated further.
So do you also offer colon cancer screening tests in your clinic?
Yes, we do offer screening for colon cancer in our clinic, and especially patients coming with rectal bleeding, they do need to go for screening. And also any patients more than 40 years and above, whether they have symptoms or not, they do need to come for screening for colon cancers. And this is a simple test done in the hospital setting and takes about 40-30 minutes to be done.
Besides the patients with rectal bleeding, which other patients would you advise to undergo the rectal screening, cancer screening?
All right. So any patients who have chronic problems of anemia or low iron level needs to be checked to look for the cause. And any patients coming with a history of a recent change in their bowel movements, things like chronic diarrhea or constipation must be investigated. And we also see patients coming with non-specific symptoms like abdominal pains, discharge from the anus, or bloating and lots of gas in the abdomen. Those also need to be investigated. And last but not least, any patients with risk factors for colon cancer, for example, a strong family history of colon cancer must be checked for colon cancer.
Okay, thank you, doctor.
Thank you, Marcelo, for your time.